Hi, I am Dr. Taylor McFarland, and if you've found this video, it might be in a fit of desperation trying to avoid your child going to the hospital for admission, for IV antibiotics, or for fluids because they just are not taking their medicine. They're clamping down, they're pursing their lips, they're not letting you in there, they're spitting it out. I have a solution for you, okay? I think we can figure this out and keep them out of the hospital. If it works, let me know. I really hope it helps. Two things you need. One is a medicine syringe. So this works for water. If they're dehydrated, they're not even taking popsicles, you can deliver water in this way, or liquid medication. So this will pretend is liquid medicine, and you want to put it in this medicine syringe. You're gonna measure the amount that they need, and you're gonna squirt it in as we dictate. And if they spit a little bit out or some is lost, you're not gonna put more. So that is one thing I want you to remember is you never go back and add more medicine. You give the dose. If they spit a little out, they spit a little out, but you don't wanna end up giving them too much. You can't account for how much was lost. So standard practice is not to keep giving till you think you give the amount, you measure it, you try to give it, you don't give more than that. So the second thing that you'll need, ideally if you can, although you can do this alone, is another adult to help you. I'm going to show you in a little video overlay positioning called knee-to-knee position. It is what we use in pediatric dentistry to examine our youngest patients because the AAPD does recommend that a child's first visit to the dentist occur by their first birthday at the latest. So we're seeing young babies. We use this up until they're about age 3, but even older kids that are having a hard time will use the knee-to-knee position. As you can see, it is the child leaning back into the lap of the dentist while the parent is holding their hands, holding the rest of their body, holding them stable. For giving medicine, you may not want to lean them all the way back. You can lay them back on a pillow, something so they're partially reclined, but this is going to give you, you're in the doctor position, the one with the medicine, to give you the ability to get into this position called the retromolar pad position. I'm going to show you that in just a minute for delivering this medicine. So you've got your syringe, you have another adult to help you, or you've positioned yourself with your child laying down on a pillow, perhaps your legs on their arms to help hold their arms steady, and you're going to give the medicine this way. So the place you're aiming for is called the retromolar pad. Where that is a little gummy triangle between the backmost molars. If they don't have molars, it's just the back of the edge of the gums of the jaw. It's right here. So it's this little spot. So if they are pursed closed, you're gonna sneak your finger in between their lips, and this works for toothbrushing too. And then you run your finger along their cheek. And they can't bite you because your finger is out by the cheek. You move with them, they're not gonna bite you. And that will allow you to see back here. Now, when they're clamped down, it's a very tight space. It's right back here. But can you see I'm getting my syringe pointed toward the throat because that's where we are trying to aim and inject the medicine about 1 milliliter at a time, and they will reflexively swallow when it's back there. They do not taste it as much when it's back there, so that helps too with the act of swallowing. And then if they are spitting, what you can do is have that second adult, or you, depending on whose hands it works best with, have someone retract their lips out and they won't be able to spit it out at you. If you're getting most of it back behind that retromolar pad, they're going to be swallowing it, but sometimes even then they can get it up there, they just can't swallow it and they'll spit it out. So you go like this. And try this at home. Like you can't spit. If someone's holding your lips out, you need your lips to push it out. So they won't be able to spit it out if someone is retracting the lips. Can't spit. Once you understand where this position is, you don't really have to use your finger to visualize. You can literally separate their lips with the syringe, move it back along their cheek, angle it back behind the retromolar pad, and inject back there 1 milliliter at a time. Oh, here it is. And they'll swallow. So here it is on the typodont. This is their mouth. This is the molar teeth. This is the retromolar pad area. So you're aiming right back at this little triangle. You come in between the lips, you run along the cheek, and then you turn it, and so you can see this is the throat area. You're aiming that little syringe to squirt about 1 milliliter at a time into their throat. That is going to allow them to reflexively swallow that milliliter or so at a time and get that dose of needed medicine or hydration to help keep them hopefully out of the hospital. Hang in there. I hope you've got another adult to help you. It can be really stressful trying to help a stressed out, crying, sick child. Just know that you've got this. Try and stay calm and confident as much as you can. Exuding confidence is going to help them feel safe. Try not to yell or scream or cry yourself, and ensure them that you're helping them. You're getting medicine that they need to feel better, and that it will all be over soon. This technique won't take you very long. It may be a little difficult for you at first to find that space. Maybe practice first with water if you're not sure. And that's another great tip as we go on to the next video is you can try and do this at low stakes times with just a syringe with water. So practice delivering medicine. Like if you're somehow stumbled across this and it's not because you have a sick child, you've just got a baby and you're wondering how to deliver medicine, liquid medicine, practice doing this while they're sitting upright, while they're at snack time, meal times, and just give a little bit of water in that retromolar pad area and just practice playing doctor, playing sick, playing get well. You can even use juice to incentivize if it's something that tastes good that may make them want to do it more. And that's one way to get them used to taking medicine, desensitized to this. If you do give it this way and it is a little bit traumatizing, it's a little bit difficult, you can desensitize them again by practicing this at low stakes times, so that hopefully later, when they are sick, not able to compensate as well, they've now got practice under their belt of having this in an easier way, and they know what to do and you know what to do. All right, I hope this helps. If you've got questions, let me know in the comments. If this was helpful, you want more tips and tricks, be sure to subscribe and then hit that join button. If you want to get to know me a little bit better, you have specific questions you'd like answered. I love this community. I love getting to know you all. And then YouTube here is going to show you the video that they think you'll like to watch next.